Hello, I'm Lyndsey Hookway. I'm a paediatric nurse, health visitor, international board certified lactation consultant and gentle sleep coach. And this short presentation should help you understand a little more about growth spurts, or as I prefer to call them, frequency days. So a little known fact is that breastfed babies drink about the same amount of milk between 1 and 6 months. And this isn't very well known because most people assume that just like formula-fed babies, that breastfed babies will need to carry on drinking more and more milk the bigger and older they get. And this is simply not the case. And the reason for that is that babies' rates of growth slow down, and also babies can extract nearly all of the nutrients from their breast milk because it's in a human form and easy for the baby to get what they need from their milk. So in that case, why do babies sometimes go through periods of very frequent feeding? And if that's not to increase milk supply, then what's the point? And if this doesn't increase milk supply, what are they doing? And why do breasts feel softer during those times? A lot of women feel very underconfident when their baby is feeding frequently or more frequently than usual because they interpret that as either not having enough milk or their baby struggling to get their milk supply increased enough to meet their growing needs. So hopefully the next few slides will help you to understand this behaviour so that you can feel confident to carry on breastfeeding your baby for as long as you choose to. Okay, so primarily the reason that babies have frequency days is because their little brain is a work in progress. And if you've ever had a time when you've been learning lots of new things, so perhaps you've been cramming for an exam, or you've been at a study day or on some training, or perhaps you've been swatting up for an interview, or learning for your driving theory test, or anything, you've probably noticed that when you're learning new things, you can sometimes get a little bit irritable, a little bit grumpy, and your appetite increases a little bit as well. And in the same way, just like adults do, when babies are feeling a bit unsettled or ratty, their sleep tends to be disrupted, and they also will look for the thing that provides comfort to them. And if you think about it from your baby's point of view, you are their primary source of comfort. And for your baby, breastfeeding is not just about food. And if you watch the video on why is my baby feeding so frequently, you'll understand a little bit more about the fact that breast milk is much, much more than just about food and drink. And so babies feed frequently when they need extra comfort, not just extra food. So that little brain that is growing and learning new things needs fuel, and also it's going to make your baby feel a little bit unsettled, and they're going to reach out for more comfort than usual. So in the early days, when you feed more frequently, or if you express, yes, that will increase your milk supply. But after about a month, actually there's no evidence that if your milk supply has been well calibrated to meet your baby's needs, that a few days of frequent feeding really doesn't make a lot of difference to your milk supply. And babies never access all the milk available in the breast. It might feel like your breast is completely soft and empty at the end of a feed, but it really isn't completely empty. There's always a little bit of milk left in reserve, and it's extremely fatty, creamy milk. And when the baby has had enough of that creamy milk, they will pop off and feel content. But the milk isn't all gone. And during frequency days, babies will access a little more milk than usual, which is why when your baby is going through these bouts of frequent feeding, your breasts may feel very, very empty. They may feel emptier than they've ever felt before, and that's because your baby is accessing that little reserve fraction of milk that they don't usually access during a normal feeding pattern for them. But there's no evidence that your baby doing that for a few days will increase your milk supply permanently. So it will return to normal once the feeding frenzy is over. So it can help to know roughly when these bouts of frequent feeding are going to happen. And babies are quite consistent, really. A lot of babies will do one of these feeding frenzies sometime between the 3rd and 5th day of life, which usually corresponds to your milk coming in. So often you can have a little bit of a honeymoon period with your baby for the first day or two, with them being quite sleepy and not particularly interested in feeding. And then very, very often your baby will become very, very interested in feeding and will want to feed a lot. And it's absolutely appropriate to just go with that and get your milk supply established really nicely in the early days. And then the second very common time this happens is around 2 weeks, and this is a really common time for women to start losing confidence in breastfeeding and to think that they need to supplement their baby with bottles of formula. And of course this isn't about those medically necessary supplements, and it's also completely your choice if you choose to supplement your baby with formula. But what I'm really talking about is helping you to feel confident in your milk supply so that you don't give formula if you don't want to. So around 2 weeks is a very, very common time for babies to have another one of these feeding frenzies. There's also one that usually happens round about the 6-week mark, and this is an extremely difficult one because at around 6 weeks usually your milk supply is quite well established, and a lot of times women feel a lot softer breasted then anyway. And at the same time their baby's pooing frequency can slow down around this time. So a lot of women interpret their baby's very frequent feeding behaviour with a generally softer breast and less frequent pooing, and they put all those things together and sometimes assume that they've got a problem with their milk supply. And unfortunately it's just lots of things colliding at the same time. So provided that your baby is gaining weight normally, you can check with your health visitor to make sure, but usually this is just one of those classic fussy times that happens at around 6 weeks. Every baby is different, however, and sometimes babies have more frequency days than other babies, but most of the time they last round about 3 to 6 days. So you can expect to feel a bit frustrated, perhaps a little bit confused. Some women find that they really can't get out of the house as much as they usually do because their baby wants to feed all the time. You might also notice that your baby is more cranky and difficult than usual during these times, and that's because they're up to something. They're learning something new. It's usually only apparent in hindsight what that something new is, but it's always something. So the trade-off is usually that your baby is learning a new trick. So get ready for that smile, or a new skill that your baby has learned, such as focusing on your face perhaps, or learning to roll. So you will know in hindsight why your baby was being a bit unusual for a few days. And it helps to have a few strategies up your sleeve for how to cope. And for a lot of women, just knowing that this is normal and it will pass is enough to help get them through it. And if women understand that it is temporary, it's short-lived and completely and utterly normal, that might be all the reassurance you need. But it does help to be a little bit organised and to plan very easy, straightforward meals, or if you've got some things in the freezer, it's a good time to dip into your freezer stash. It's a good idea to make sure that you've got lots of snacks handy, because it can be quite difficult to look after yourself if you've got a baby who doesn't really want to be put down for a few days. Learn how to feed lying down so that you can get some rest as well during all these frequent feeding episodes, and ask your health visitor how to share a bed with your baby safely. So there are lots of things you can do to make life a bit easier for yourself. But just know that all annoying phases do come to an end eventually. So hang in there, keep calm, and keep breastfeeding if you want to. I hope that's helped you to understand a little bit more about frequency days. Thank you for watching.